My name is Todd and I'm Private Secretary to David Lammy, Minister for Skills. Unfortunately, David has suffered a family bereavement and so is unable to give this speech, but he's asked me to deliver it on his behalf. Hello everyone. I'm sorry not to be able to join you in person today, but I'm pleased nevertheless to have this chance to make a contribution to your discussions. That's partly because any occasion devoted to raising awareness of this country's need for skills is an important and worthwhile one. And it's partly because the emotional links between my party, this government and the health service remain just as strong as they were when the NHS was created 50 years ago. Is there any organisation whose example brings the benefits of having skills of all sorts home to us quite so forcefully as the NHS? If there is, I can't think of it. It's true that today's NHS hospitals are more full of high-tech equipment than they have ever been. That's especially evident in the South East, where so many of our great teaching hospitals are based, and that a much wider and more powerful array of medicines than ever before is at clinicians' disposal. But that fact in itself brings home to us the necessity of continually updating and developing workforce skills. Doctors and consultants have always known that to keep giving their patients the best care available, they must keep up with new treatments and techniques. But the vast range of medical hardware and pharmaceutical products that's now available also poses a skills challenge to those who maintain and operate the equipment and those who are in charge of the drugs. The skills issues that the health service must constantly address are by no means only technical either. Nurses, for example, certainly have those sorts of skills. But most of us who've had experience of the NHS as patients or their relatives will agree that it's what they've learned about caring and dealing with people that we often value the most. The need for skills in the NHS isn't confined to very high-level ones either. Time allows me to give only one example, but I think it's a good one. We'd do well to ask who, in these days of MRSA and C. difficile, is more crucial to the successful treatment of patients than the person who cleans the ward. The people who work in the NHS are the people we have to thank that it is still the envy of the world, and they need to be right at the top of our list of priorities for continuous education and training. That's why our ambitions on skills for the health and social care workforce must be to match and exceed the best in the private sector. It is people on the front line, doctors, nurses, carers, social workers, who we depend on to make our national ambitions a local reality. And it's how we invest in the people who work in these professions and those who want to join them that will ultimately determine how successful we are. Today's event will take discussion of how we can do that most effectively another step forward. That is why I'm committed to the Joint Investment Framework, which will see funds released to develop skills at all levels, and it is also why I'm encouraging you to join the growing number of employers, over 1,000 to date, who have made the Skills Pledge, a public commitment that they are investing in the skills of all of their employees. I congratulate those of you who have made it already and hope that you will encourage your peers to do likewise. I hope that you all have a very enjoyable and productive day. Thank you.